Environmental health is the science and practice of preventing human injury and illness by identifying and controlling environmental and social risk factors that affect human health and well-being. Environmental health involves all aspects of the natural and built environment that may affect human health. The environmental health professional identifies and evaluates hazardous agents and exposures in natural environments, such as air, soil, and water, and in the built environment, including homes, buildings, streets, and infrastructure. An environmental health professional ensures environmental health systems are in compliance with local, state, and federal regulations. Environmental health professionals focus on model practices, policies and procedures, and reducing risk and hazards to keep citizens safe and healthy. Environmental health professionals have a wide variety of duties. They can include investigate, sample, measure, and assess hazardous environmental agents in various environmental settings, recommend and apply protective interventions that prevent, minimize, or control hazards to health, develop, promote, and enforce guidelines, policies, laws, and regulations, develop and provide health communications and educational materials, manage and lead environmental health units within organizations, perform data and systems analysis, interpret results and identify trends, engage community members to understand, address, and resolve problems, review construction and land use plans and make recommendations, interpret research utilizing science and evidence to understand the relationship between health and environment, and prepare technical summaries and reports. Depending on your jurisdiction, certain food establishments are regulated by certain departments. For example, the Department of Business and Professional Regulation is the regulatory agency in Florida, and the Georgia Department of Public Health is the regulatory agency in Georgia. The food safety system is a continuum that begins with food producers and ends with point-of-service establishments, such as grocery stores and restaurants. These food establishments are very dynamic systems. They receive, store, prepare, cook, cool, reheat, hold, assemble, package, and serve food. These actions involve food workers, equipment, specialized processes, policies, management, and economics. Environmental health professionals ensure our food is safe by educating, inspecting, and conducting environmental assessments in facilities throughout the food supply chain. Now, let's discuss the differences between facility plan reviews, inspections, and environmental assessments. A facility plan review is a preemptive activity to identify and mitigate potential food safety problems in the future. They are undertaken to promote healthy and safe food system environments and operations to reduce risks to human health. They focus on proposed structural plans and equipment at the establishment, relation to intended procedures, and functionality, durability, and ease of cleaning. Facility plan reviews are initiated by establishments. Hazard analysis and risk-based preventive controls, or HARP-C, is the system used to control the different hazards found in facilities that manufacture food. It is the process that food companies use in facilities to implement food safety plans. Unlike the Hazard Analysis and Critical Control Point, or HACCP, HARP-C includes planning for potential terrorist attacks, intentional adulteration, and food fraud. HARP-C is not a global standard. It is an updated U.S. standard that was incorporated into the Food Safety Modernization Act in 2012. Food establishment regulatory inspections focus on real-time health and safety conditions. Environmental health professionals assess processes and procedures and food safety problems they observe at the time of inspection. They are typically risk-based, attempting to identify and provide greater emphasis on factors that cause foodborne illness. Inspections occur on a regular basis and are typically unannounced. Depending on your jurisdiction, food establishment inspections may result in either a letter grade, a number grade, pass-fail score, or other scoring methodology. An environmental assessment is a team-based evaluation of environmental factors that contributed to the transmission of illness. Environmental assessments are an important step of outbreak investigations. They provide effective short- and long-term interventions and recommendations to mitigate ongoing foodborne outbreaks and prevent future illness. Environmental assessments are conducted in response to an outbreak. They focus on past processes and procedures that may have contributed to a specific outbreak. They attempt to identify how the causative agent, food vehicle, processing methods, contributing factors, and environmental antecedents made people ill. Environmental assessments should be conducted throughout the food production system, including farms, processing facilities, distribution facilities, restaurants, and other facilities that serve, prepare, or package food. The four major objectives to an environmental assessment include reconstructing past events that focus on implicated foods, identifying contributing factors, identifying environmental antecedents, and developing effective interventions. In preparation for an environmental assessment, an environmental health professional must become familiar with the available outbreak information, such as routes of exposure, exposure dates, incubation periods, the causative agent, and food items consumed. They must understand how the causative agent can be transmitted in order to identify potential food vehicles and routes of transmission. The environmental health professional must also understand contributing factors and environmental antecedents. Contributing factors are elements that increase the risk of foodborne illness and repeatedly contribute to outbreaks. The three major categories of contributing factors include contamination, survival, and proliferation. The identification and correction of these factors facilitates prevention and control of foodborne diseases. Environmental antecedents are the root cause or circumstances that set the stage for contributing factors to occur. Examples of environmental antecedents include economic constraints, inadequate worker education, management decisions, and social and cultural beliefs. Environmental health professionals should attempt to identify contributing factors and environmental antecedents during environmental assessments. During an environmental assessment, environmental health professionals are usually accompanied by an epidemiologist and, if applicable, a representative from the appropriate regulatory agency. Prior to the environmental assessment site visit, the investigation team attempts to collect and review existing regulatory records, menus, recipes, product formulations, and standard operating procedures and processes that are related to the incident they're investigating. This allows the team to become familiar with the establishment before the assessment takes place. Upon arrival at the food establishment, the investigation team focuses on implicated foods that were prepared during the time period of the outbreak. The team interviews managers and food workers, walks through the facility, observes operations, and if necessary, collects food samples, environmental samples, and clinical specimens. It's important to gain cooperation of the management while conducting an environmental assessment. When interviewing the establishment manager, their knowledge and attitudes toward food safety are assessed. This helps the environmental health professional gauge whether the manager routinely reinforces proper food safety practices and procedures. Epidemiologists or environmental health specialists may choose to interview staff members in a confidential manner and ask about recent illnesses by doing one-on-one interviews. Food worker interviews can identify who prepared the implicated food and the chronological sequences of preparation. This helps reconstruct a timeline that can later be verified during the facility walkthrough. Food worker interviews also identify any unusual circumstances that may have occurred that day, such as malfunctioning equipment, staff shortages, or persons who prepared food while ill. During a facility walkthrough, the environmental assessment team can review the general layout of the food establishment. They observe processes for preparing the implicated food item and verify who worked with the implicated food. By observing facility operations, the team can attempt to reconstruct how the food items were prepared. The environmental assessment team focuses on the exposure period of interest, as this will help reconstruct relevant food safety practices and procedures that may have occurred in the past. During the assessment, the environmental health professional records measurements of time, temperature, product usage, and sanitizer concentrations. Documentation of employee work schedules, employee contact information, and maintained records, such as temperature logs, are collected for the time period of interest. Together, the review of documents, procedures, and interview information helps to identify contributing factors and environmental antecedents. Prior to and during the environmental assessment, the environmental health professional may consult with a public health laboratorian to ensure that food and environmental samples are collected in a representative manner. Once results are obtained, They are sent back to the environmental health professional and epidemiologist for interpretation. Data obtained from environmental assessments should be entered into the National Outbreak Reporting System, or NORS. NORS is a web-based platform primarily used by epidemiologists. It was developed by CDC and is intended to collect reports of enteric disease outbreak information from health departments. Examples of variables collected in NORS include date and location of outbreak, the number of people who become ill, the pathogen that caused the outbreak, and environmental contributing factors. In addition to NORS, the National Environmental Assessment Reporting System, or NEARS, has been developed by CDC. NEARS is primarily used by environmental health professionals and is a national surveillance system that enhances the identification of environmental and contributing factors of foodborne outbreaks. NEARS serves as a repository for state and local programs to report data collected from environmental assessments during foodborne outbreaks. State and local jurisdictions can choose if they want to participate in this surveillance system. Using the data collected by participating state and local programs, NEARS aims to improve prevention, intervention, and food safety practices to reduce the number of foodborne outbreaks. Our next video will apply the duties of a foodborne epidemiologist, public health laboratorian, and environmental health professional to a foodborne outbreak investigation and demonstrate the coordinated activity to successfully investigate a foodborne outbreak.